Daily ejaculation and prostate health, myths and facts. Does ejaculating every day protect you from prostate cancer or harm your sexual health? Conflicting information abounds, and myths can create unnecessary anxiety. Scientific studies provide some insights, but the real picture is nuanced. This article explains what research suggests about ejaculation frequency, clarifies misunderstandings, and offers balanced guidance on maintaining prostate and sexual health. What the studies show. Much of the conversation stems from two large retrospective studies published in 2016 and 2017. Researchers asked tens of thousands of men to report how often they ejaculated and then looked back over many years to see who developed prostate cancer. The findings were intriguing. Men who ejaculated 21 times or more per month had a lower incidence of prostate cancer compared with men who ejaculated 7 or fewer times per month. The reduction in risk was roughly 20 to 30%. One theory behind this association is the prostatic stagnation hypothesis. Ejaculation may help flush out fluids, waste products, and potential carcinogens that collect in the prostate ducts, reducing inflammation and cellular stress. Another possibility is that the hormonal fluctuations around sexual activity promote healthy cell turnover in the gland. Lower stress levels from sexual release might also contribute to a healthier immune environment. However, it's important to interpret these findings cautiously. Retrospective studies rely on participants' memory of how often they ejaculated, which introduces recall bias. The studies did not control for all lifestyle factors. Men with higher ejaculation frequencies might also lead generally healthier lives, exercise more, or have better diets. Correlation does not prove causation. Therefore, while frequent ejaculation might be one protective factor, it should not be seen as a guaranteed shield against cancer. Is not ejaculating harmful? Many men worry that abstaining from ejaculation could allow semen to build up, causing discomfort or health problems. In reality, the body is efficient at recycling unused seminal fluid. If you go for a period without sexual activity, your prostate, seminal vesicles, and other glands will reabsorb, break down, and reprocess the seminal components. Occasionally, during physical exertion or bowel movements, some fluid may leak, but this is harmless. There is no evidence that infrequent ejaculation causes prostate cancer, or that blue balls, the aching sensation after prolonged arousal without release, leads to lasting harm. That discomfort results from temporary blood congestion in the testicles and resolves on its own or with orgasm. Hypoactive or infrequent sexual activity can have other consequences, though. A lack of regular erections and ejaculation may contribute to weakened pelvic floor muscles and decreased penile elasticity, potentially leading to erectile difficulties. Sexual inactivity may also be associated with higher levels of stress or mood disorders for some men, which can indirectly affect hormone production and immune function. Maintaining a healthy sexual life. Rather than focusing on a magic number of ejaculations, aim for a balanced, enjoyable sexual life, whether with a partner or through self-pleasure. Regular erections and orgasms promote blood flow to the genital tissues, maintain pelvic floor muscle tone, and provide stress relief. At the same time, over-prioritizing ejaculatory frequency as a cancer prevention strategy can lead to unnecessary pressure and anxiety. Sexual health is highly individual. Some men feel best with daily orgasms, while others prefer less frequent encounters. Listen to your body and respect your needs. Good prostate health is anchored in overall wellness. Eat a diet rich in vegetables, fruits, and healthy fats. Stay active to maintain a healthy weight. Avoid smoking and limit alcohol consumption. These habits benefit your heart, blood vessels, and endocrine system, which in turn support sexual function. If you have concerns about your prostate, talk to a healthcare provider about screening options such as prostate-specific antigen (PSA) testing. For men over 40 or those with a family history of prostate cancer, regular checkups are essential regardless of sexual activity. Conclusion. Frequent ejaculation appears to correlate with a reduced risk of prostate cancer, but it is not a standalone cure or preventive measure. Abstaining for short periods does not harm you or cause disease, and every man's optimal frequency will vary. Focus on a holistic approach. Maintain healthy lifestyle habits, engage in satisfying sexual activity that feels right for you, and consult a medical professional for personalized guidance. By keeping perspective and caring for your overall well-being, you can support both prostate health and a fulfilling sex life.